which is not regarded as a suspicious change for malignancy in a junctional nevus mole, right? So just giving you guys a little bit of time to answer this. This is a straightforward question. Either you know it or you don't know it. So have a chance to answer. Alrighty, cool. So I'm seeing the answers here, all right? So let's go through it. This is a straightforward question. As I mentioned, there's no teaching points here. It's just something for you guys to memorize, and I'm gonna tell you what to memorize to answer the question, right? Whenever you encounter a question that's talking about moles, just remember A, B, C, D, E, right? A references asymmetry, B references, one sec. Okay, all right, cool. B references border irregularities. C is color variation. D is diameter greater than 6 millimeters. And E is evolving, right? Evolving in terms of size. It can evolve in terms of shape or color. So I always think about these particular criteria as you encounter any form of dermatology question related to moles and whether it's malignant or not. So we're going to look at it, right? So first of all, according to my little criteria here that I just set up, which is A, B, C, D, E, that you guys should remember, we have A for asymmetry, right? So if you get a question, it shows you a picture, just take a piece of paper in the MBBS exam and just split it down the middle, right? And I just did it here and just compare the sides. If they look somewhat close after you split it in half, it's a benign mole, right? If you split it in half, as I just did here, and it kind of looks strange, like it's not matching up as it should, then it's a melanoma or it's a malignancy, right? So that's asymmetry. Border irregularities, if you look at this picture here on the left, where I have benign mole, the border is pretty normal. It's pretty smooth. It follows a particular pattern. It doesn't go wavy like the image on the right, right? And then color variegation just means you have different colors in the mold. So I'm not sure if you guys can appreciate it, but on the right, the center is a bit darker. Then you have a little light patch over here, and then a little brown on the peripheries, right? So that's, difference in color versus the benign mole. It's just pretty uniform throughout. And then diameter, anything greater than 6 millimeters, it's likely a malignancy as well. And then the next thing is evolving size, shape, color. So I'm going to go through that. So when it talks about evolving size, they might say, okay, you have John. John had a mole. He never found any problem with it. But then for the last month or so, the mole has been increasing in size. That's evolution. Or they can say it starts to have a little bit of satelliting, or the shape is changing a bit more. So it says evolving shape can mean development of satellite lesions, right? Satellite lesions just means there's a malignancy and it's spreading to other areas of the skin. And then evolving color, meaning it was probably brown before it started get a bit darker now, that kind of thing. So if you look at the answer options, again, this is a first order question, nothing more to explain. A says satellite lesions. It can't be A, right? Because the question says, which is not regarded as a suspicious change. So we're ruling out anything that can be used as a suspicious change, right? So satellite lesions can point towards a malignancy. Increased pigmentation can also point to malignancy because we saw evolving color, right? Rapid growth also can point towards malignancy, as we saw, evolving size. And then bleeding. Bleeding also points to a malignancy, and I'll explain exactly why. So you see here where it says evolving size, right? Always remember, and this is very high yield. I'm not telling you guys anything that, is just random factoids and, oh, you can laugh about it and show off. No, everything here we're focusing on exam purposes. So evolving size, when you think about evolving size, the moles can evolve in size horizontally as well as vertically, right? So when I say vertically, I mean it can go further down in the skin. It can go deeper down in the skin, right? As it's going deeper in the skin and as it's growing, whether it's vertically or horizontally, as it's getting deeper, the size of the tumor is growing. Always remember, any tumor that's growing, it needs more blood because it needs the blood to get more oxygen to continue growing. So what you find whenever you have any form of growth is you'll get new blood vessel formation. And the thing about tumors is as the blood vessel is growing, it's those blood vessels, because they have to grow so rapidly, they don't get time to form properly. They're very unstable, right? So the unstable blood vessels, they rupture easily and they bleed easily, right? So always bear that in mind. Now, on the same note where I mentioned moles can grow vertically, also remember something called Breslow's depth, right? This isn't something you have to swat. Don't waste your time swatting the whole criteria for Breslow's this and Breslow's that. Just remember, as a mole grows vertically, it gets deeper. And there's something called a Breslow's depth, right? So this particular thing, the Breslow's, it indicates prognosis. So the deeper a mole goes, the more likely it is to metastasize. So they can give you a question on MBBS that says something like, which of the following is a good indicator for prognosis for a patient with a mole? And they can say something like, color change, diameter, asymmetry, or they can say depth, right? So always remember it's the depth that they use. It's the depth that they want as the indicator for whether it's a bad prognosis or a good one. That's high yield. Make sure you remember it. And make sure you remember the criteria as I mentioned here. So we'll finish with that one. So based on just elimination, we'll have our answer, which is pain, right? So that's our answer. Answer is pain. And obviously, if you have any form of lesion, it can be accompanied with pain. I'm not saying that malignancies won't have pain, but it can or cannot. And it's not a criteria for you to use to indicate that you have a malignant mole or whatever the case is. So pain is the answer based on just elimination, right?